Hey, what's going on everyone? Welcome back to my channel. In today's video, we're going to look at 3 exercises for nerve pain that goes down the leg. So maybe you have sciatica, pain that travels down the back of your leg, into your hamstrings, down to your calf and foot. Or maybe you've got pain that travels down the front of your thigh in the kind of quadricep region. If you've got symptoms in either of those places that seems to travel down the leg, stay tuned for today's video. So first we're going to look at the sciatic nerve. Sciatic nerve starts in the low back, the lower part of the lumbar spine, goes down through the buttock area, through the hamstring region, and then it branches at the back of the knee. One branch goes over here onto the kind of peroneal area, the side of the lower leg, and down into the foot. And the other one travels through the calf and onto the sole of the foot. So if you've got pain anywhere along that back of the leg, travels down into the sole of the foot, the top of the foot, into the shin area, the sciatic nerve is what you're going to want to look at. So this first mobilization is called a straight leg raise, and we're going to look at a way to basically help the nerve slide and improve blood flow to the nerve. That will be the case for all of these mobilizations. So for this one, you want to start here. This one's less stressful on the nerve, and then the next exercise will be a little bit more challenging. So maybe start with this one if your symptoms are more sensitive right now. You're going to lay on your back, and if the symptoms are in my right leg, I'm going to pull my leg up like this to start with and hold behind my knee, kind of support my leg with my hands. And then you'll put your head down, and what we're going to do is we're going to point the foot and then raise the leg up like that. So the knee is going to straighten while pointing the foot, and then as I come down and bend my knee, I'm going to pull my ankle back in a dorsiflexion. So when I pull my ankle back like this, it tensions the nerve at the ankle while it's on slack here at the knee. And then as I straighten my knee and the nerve gets tight behind the knee, I'm going to point my foot and put it in a looser position at the foot. So I'm going back and forth like that. Okay, so pull the ankle back, bend the knee, and then straighten the knee and point the foot. And you're just going to mobilize the sciatic nerve like that. Okay, so that's one option you can try. Another one is to straighten it up to where you feel some tension in the hamstring region, and then just move your ankle through plantar flexion and dorsiflexion right here. You'll feel that when your ankle comes down like this, it will tighten the nerve and cause more of a stretch, and when you point your foot, it will get looser and less of a stretch. You're just kind of going between the two, basically kind of tugging on that nerve and trying to help mobilize it. So you can kind of play with these two different versions while you're laying on your back to help the nerve glide and move and to help reduce symptoms. Okay, so that's the first sciatic nerve technique, a straight leg raise position. Our second technique here is going to be for the sciatic nerve again. This is called the slump position. I will be in a seated position. This is going to be more challenging than the last one. It's basically going to involve rounding the spine into flexion, which tensions our spinal cord and the nerves that come out of the spinal cord. So for this one, what you're going to do is put your hands behind your back and slouch down. And again, if I've got the sciatic nerve pain on my right leg, I'm going to pull my ankle up like this in a dorsiflexion. And then as it comes up and I straighten my knee, I'm going to plantar flex my ankle and point it. So I'm going to go back and forth between those two like that. Just ankle and knee movements to start with, kind of holding my spine in this rounded position. So pointing the foot as it comes up. Now another one you can play with here is to bring your knee up straight, and this time I'm going to do an ankle and head movement. So when my ankle points down and my sciatic nerve is relaxed a little bit, I'm going to pull my head down, which will tension my nervous system, and then I'm going to reverse that. So when I lift my head and reduce tension here, I'm going to pull my ankle back and put a little more tension down here, and you'll feel more stretch, and then just alternate between the two. So a head and ankle kind of mobilization that works on mobilizing the nerve and flossing the nerve. Okay, so again, this is the slump position. It's more challenging on the nervous system as compared to the one laying on the ground. So just figure out the right level for you. You don't have to do both. You're just finding the one that works best. If you have pain that travels from your low back down the back of your leg, this is really for people with more sciatica type symptoms. The last exercise will be for the front of the leg. So if you've got those kind of problems, go to the next exercise. Our last mobilization here is for the femoral nerve, which also starts in the low back, the upper part of the low back, and then its branches run down the front of the thigh. So less people have nerve issues here, numbness, tingling, things like that, but if you do have it on the front of the leg, this is one to try. So this can be done in side lying or in standing. I'm going to show the side lying one here first. So if my right leg has the symptoms, I'm going to have that leg on top, and then what I'm going to do is kind of grab my ankle, and I'm basically going to be going into what most people would do is like a quad stretch, kind of a runner stretch. But instead of holding it, which can aggravate the nerve sometimes, I'm going to kind of come on and off of that position. So I'm going to pull my leg back and then pull back forward. And I'm just looking to, again, focus on the nerve more so than the muscle. So putting the nerve on tension here and then back off of tension and trying to get it to kind of slide more easily and sort of desensitize it. Okay, so it's like you're doing that quadriceps runner stretch, but you're not holding it at the back spot. You're just moving on and off of that position to help reduce nerve symptoms. Okay, so that is the side lying one. I'll also show it in standing. So this is just another variation of that femoral nerve mobilization. I actually kind of like this standing one better. We can put the head into it, and it's just a little easier, I think. So hold on to the wall so you don't have to balance. Again, if my right leg has the symptoms, I'm going to go into this position. I'm going to put my hip in a little bit of flexion where my knee's forward. When my hip is here, it puts the nerve on slack. It reduces tension on it. So when that's the case, I'm going to put my head down, which tensions my nervous system up higher. And then as my leg comes back and my leg stretches more, my head's going to lift. So that takes tension off up at my neck, but puts more tension down below. And then I'm just going to go back and forth. It kind of looks like a funky dance move, but we're basically pulling the nerve from one time towards the neck and then the next time towards the leg. So we're trying to pull it up and down and basically help it slide and to help get oxygen and nutrients to the nerve. Okay, so that is the femoral nerve mobilization. There are other nerves in the leg, of course, but most people who have nerve symptoms in your leg are either down the back and related to the sciatic nerve or one of its branches, or on the front of the thigh and related to the femoral nerve. Give these a try. If you have any questions, put them in the comment section and I'll try to get back to you. All right, you guys, see you next time. Bye.